What Community Impact does is the United Way is able to bring in a program that gave probably half a dozen to a dozen health and human service agencies in the area over $3 million. That money would never have been able to come into our community if it wasn't for the United Way's controls and checks and balances. So that's another reason why it's important to continue contributing to our local United Way. The funds that you give are able to be used to attract funds that wouldn't come otherwise.
My name is Margaret. My first job out of college, one of my duties was to organize the United Way Drive. From there, I started in advertising as a secretary, retired as a vice president. It was wonderful. Worked very hard for very many years. And now at 64, I find myself unemployed, uninsured, and living completely on Social Security. I never expected it to happen to me. I thought I was a very good planner, and yet here I find myself. I'll be 65, at which point I'm eligible for Medicare. Cape Fear Health Net has just bridged the gap for me in the meantime. And I have had health issues in the last year, and they've been here for me and wonderful and respectful and courteous and competent. And they're just a wonderful organization, and I'm very thankful for them. You're not helping some nameless, faceless people who don't want to do something different. You're helping your neighbors. You could eventually be helping yourselves.
I'm Jessica Green. I am the supervisor of the Rape Crisis Center of Coastal Horizon Center Incorporated, and I am working with the Regional Domestic and Sexual Violence Victim Mental Health Service Project funded through the United Way Community Impact Fund. In this initiative, we are able to have a collaborative effort with other programs, and we are able to provide services that will have a far greater impact than any one program can provide. People were not getting the services that they needed. They were experiencing depression symptoms, PTSD, they were having trouble functioning in work life and family life, and if this program were to not be available, I'm afraid that we wouldn't be able to offer this any longer. And this is something that to all the programs who are involved in this, that this is crucial, and we believe in this project. We believe that it is important to our communities that we serve, and we believe that the survivors that we work with every day benefit from this time and time again. Something that has come out of this project that I think that we didn't really expect is that we are collaborating at a much deeper level than we ever expected. We're able to share information about trends that we're noticing, issues that our survivors are seeing. And with the funding that we've received, we've been able to do a lot. We've been able to serve 365 people last year. And we believe that if the Community Impact Fund was supported even more, that our impact could be even greater.
You know, unfortunately, we have much more need in this community than we're able to award the grants for. We probably expect to have 26 well-qualified grant requests, and we may only be able to fund 13 of them. We need to do a better job of getting into workplace campaigns and talking to individual donors that are willing to hear the United Way story. They need to learn about United Way. When you have someone like the United Way analyzing the indicators to find out where your money is going to do the best for the community, you feel much better about that. Once you volunteer or have some knowledge about what we're doing, you develop a level of trust because you know it's being evaluated objectively for the best of the community.